Long-term care homes have been, of course, hit very hard by the COVID-19 pandemic. Yesterday, Minister of Long-Term Care, Merrilee Fullerton, announced that the provincial government is investing almost $2 billion annually in long-term care until 24-25. And joins us now on the phone with more details and looking forward with the government's plans on this crisis in long-term care. Good morning, Minister. Thank you for joining us.
Thank you so much.
So people are applauding the amount of money being thrown at this problem, but critics are saying that it doesn't reflect the urgency here.
Well, we've been working urgently all through this pandemic. In fact, we began with a sense of urgency when we first became a ministry back in the summer of 2019, looking at the capacity problems, looking at the staffing crises that had been ignored for so long, and taking measures using the Justice Scalise public inquiry recommendations. And then we created a staffing expert panel to advise us, and we received their report back in July, and also the commissioner's early guidance on the staffing. And so the work has been done all along. We never stopped. Certainly COVID brought a sense of urgency to, on an emergency basis, stabilize our homes using every measure, whether it was making sure that we integrated with hospitals to get their support with the infection prevention and control, or their staff, or looking at making sure that on public health units were involved immediately on the first case. So we've been working on this all along, and this is a longer-term strategy. So I want to differentiate this from the emergency measures we've been taking earlier.
Okay. Now, when you talk about staffing and the consultations that you received, how and what is going to be the ratio of staff and residents?
Yeah, and that's been up for discussion through the various groups that we've been consulting with. And what we discovered is it is very regional. And sometimes in one area you'll have access to slightly more of perhaps more PSWs or RNs or RPNs. But ultimately this is really a look forward. This is modernizing our long-term care system to meet the needs of our most vulnerable citizens who are in long-term care after many, many years of neglect. So the 4 hours of direct care on average per resident per day is something that we announced in the budget. And these dollars begin immediately in 2021-22 to support the staffing plan. So about $500 million in the first year, increasing to $1 billion in the next year, and then $1.5 billion the year after that, up to the $1.9 billion in 24-25, which we believe will be an annual expenditure. But this is about the people. It's about getting them the quality of life that they deserve in long-term care after so many years of neglect. So this is a generational change. The $1.9 billion that will go annually eventually, but there are critics that are saying this isn't coming out right away, but it is. Yeah. The dollars will be there in this coming year. And 27,000 new nurses, personal support workers, and health professionals that also assist our residents in long-term care, whether it's physiotherapists or social workers. There'll be a 20% increase in direct care through them as well. But we know we've got our work cut out for us to train, and that's why we'll be doing innovative projects, innovative training programs to get more people in the homes.
And what about recruitment?
Sorry, go ahead.
What about recruitment? Because we're talking long hours here, and the threat of daily violence and abuse from residents. Are you worried about a lack of response here? And what about job retention?
Well, absolutely. And so I've said repeatedly, and others have as well, that we can hire or train and hire more staff, but we need to be able to retain them. And this is about changing the culture and the conditions in the home to make sure that it is a better place to live for residents and a better place to work. We've seen the cracks, the light has been shone on the cracks in long-term care during COVID, and it's been an absolute tragedy in some homes. Some homes have done very well, but in the areas where there's high number of community cases, it's very, very challenging to keep it out of the homes, despite all the measures we're taking, despite the testing and the rapid testing. But the training is absolutely critical to make sure that we have the workforce that is needed, not only to support the residents, to support each other. Because as the staffing has diminished, we've seen in outbreaks, it becomes very challenging for the staff that remain. So we want to make sure that we support our staff, that we support the residents.
Yeah, it's an important issue for so many Ontarians for their loved ones. Thank you for sharing your efforts, Minister of Long-Term Care, Merrilee Fullerton.
Thank you so much.